brief on the pandemic as well as progress on the vaccination front. When we do come to the question and answer session, please use that WhatsApp number +251 9455 2310. That's +251 9455 0310. You may also come to us live on this Zoom platform, as well as utilize the question and answer section. We are coming to you in English and Portuguese, so in English and French, so please feel free to choose the language of your choice. Well, without much further ado, let me invite in the Director of the Africa CDC, Dr. John Kengasong, for his usual briefing. Dr. John, you have the floor.
Thank you, Wayne. And let me join you in extending my apologies to our colleagues that have joined this platform with us. I was called into an emergency meeting of our ambassadors, who are kind of our parliamentarians or our Congress people, depending on which system you live in. And that the topics of the day, that is access to vaccines and the issues that we'll be discussing here, are also preoccupying them. So they needed to have a very detailed briefing, which took an extended period of time, which we couldn't cut them short because they represent our member states. So my sincere apology for that delay. So let me, as usual, start by thanking you for always coming to this platform for us to discuss issues of our time, which I think history will record that this moment we're dealing with here is a trying moment for the continent and for the whole world. And there's no other way of describing that other than those challenges of our times. So I just want to start unusually today by providing some clarity on the remarks that I made last week, which were reported differently regarding AstraZeneca. And I fully understand that when we communicate on this platform, people may receive the information differently. And all I ask is that if there's challenges in understanding, I'm always available to clarify based on the timing of the topic. So let me just remind everyone that Africa CDC continues to recommend the use of AstraZeneca vaccine. So noting that the benefits of the AstraZeneca COVID-19 vaccine continue to outweigh the risk. And the clarification I wanted to make here is very simple, that the process of acquiring vaccines from limited sources, as we've all discussed in this forum, is extremely complex. So in January, we were in discussions with the Serum Institute in India, and we agreed that they will supply us with the doses of vaccines that we announced at that time, but we didn't sign any contract with them. Then it became clear that we were dealing with the same source of vaccine with COVAX, and we just didn't want to get into that competition with COVAX, which on all the vaccines were coming to the continent. So we said, good, means we have not signed any contracts with them. We will shift and find additional doses of vaccine. Remember, we always want to achieve 60% of our target, and COVAX was trying to get us 20%. We were trying to get additional doses from Johnson & Johnson. So we shifted our strategy and to Johnson & Johnson, and while leaving the COVAX mechanism to work with the Serum Institute, because we also noted that the Serum Institute was not going to have enough doses to support all of our needs. So I think there's very clearly there's not been any shift, or we didn't dump at all or drop our engagements with the Serum Institute. Just the best way to put it is this: if they have vaccines at the Serum Institute today, we'll be happy to get them. Okay, so that is very, very clearly what I just wanted to remind everybody and clarify that. Again, in the spirit of addressing a very complex situation that is unfolding in front of our eyes every day, is really to just reach out if you have a question for clarity. We'll be happy to address that appropriately. So let me now go into the epidemiological situation. As we speak today, the continent has recorded 4.3 million cases of COVID-19, of which about 116,000 deaths have occurred, representing a case fatality rate of 2.7%. So that rate, that 2.7% represents about 4% of the global total. If you look at the countries, again, that are contributing more than 60% of the cases, they include South Africa, Morocco, Tunisia, Ethiopia, and Egypt. And again, the global case fatality rate is about 2.2%. And 38 countries in Africa, that is 38% of our member states, representing 21 countries, are reporting a case fatality ratio that is above 2.2%. So let us now look at the situation with respect to the changes over the last 1 week. Over the last 1 week, we've seen the following trends. There is a week between what we call the epidemiological week 14 and 13. We've seen the following changes. New cases represents 78,000 across the continent. Those are new cases, of course, and this represents a 2% decrease compared to last week. When you now look at the different regions, the 5 regions, you see that the Northern Africa region has reported 35% of new cases, East Africa 34%, Southern Africa 15%, West Africa 8%, and Central Africa 8%. Then, if you look at the following 5 countries that are reporting the highest number of new cases, they include Ethiopia, Tunisia, Kenya, South Africa, and Egypt. So let's look at the deaths. In terms of new deaths, again, comparing last week and this week, we observed that we recorded 1,866 new deaths, and this represents an 8% decrease compared to last week. When we now look at the 4 weeks and ask ourselves the question, what is the trend over that period? And the period ranged from March 15 to April 11. We observed that there's a 2% average increase in new cases across the continent. Again, 2% average increase across the continent. That reflects that if you take everything and dump it together, but we need to disaggregate that to see the trends. So if you do that, what do you see by region? First, you have 11% increase in Northern Africa, 10% increase in Eastern Africa, absolutely no change in Central Africa, 8% decrease in Southern Africa, and 12% decrease in Western Africa. Then if you look at the deaths, you see that over the last 4 weeks, we have observed 2% average decrease in new deaths, and the distribution by most populous countries include 47% average increase in Kenya, 16% average increase in Ethiopia, 2% average decrease in Egypt, 7% average decrease in DRC, 12% average decrease in South Africa, and 45% average decrease in Nigeria. Now, let's turn our attention to testing. To date, nearly 42 million tests have been conducted across the continent, and this represents a 2.4% increase with respect to last week. As of today, a total positivity rate of 10.2% and a test per case ratio of 10 have been reported across the continent. Nearly over 10,000 people were trained on antigen testing in 17 member states alone. And so I think we are making progress with respect to rolling out the antigen test, which we believe is going to be a game changer and in addressing our COVID needs. Over 700 antigen test sites for COVID-19 have been set up. and a total of 2.5 million antigen tests have been conducted in member states. In other capacity development areas, we have about 110,000 antigen test kits were distributed to 6 member states over the last week, and that includes Zimbabwe, Sudan, Sierra Leone, Kenya, South Africa, and South Sudan through the support from Global Affairs in Canada. So with respect to vaccine updates, on the 14th of April, the Africa CDC published a statement following the reports of blood clot events that led to a temporary pause by the U.S. government, that is the U.S. FDA and the U.S. CDC, on the use of the Johnson & Johnson vaccine. The Janssen COVID-19 vaccine, as it's called, is presently only used in South Africa out of the 55 member states, with almost 290,000 doses administered. The country has not registered any reports of blood clot and thrombosis following the vaccination, according to the reports we have from the government of South Africa. However, on the 13th of April, the government of South Africa announced that the country will also temporarily pause the rollout of the vaccines as a precautionary measure as they review the situation. I just want to state here that in the United States, out of the 6.6 million people that have been vaccinated, 6 of them developed those the blood clotting phenomenon. And that represents 1 in 1 million vaccinations. I just want to be sure that we put that in context. We will be monitoring the situation very, very carefully with the US CDC, the US FDA, and the government of South Africa to understand more what the findings will look like. What I think they are doing now is basic detailed epidemiological analysis to understand who has been affected, how they were affected, what age group is it, and all those parameters. And they will unpack that, and they will be able to give us a decision on what how to move forward with that vaccine. Remember, this was a very similar scenario of what we had and observed with the AstraZeneca vaccine in Europe, and which there was a temporary pause to that, and then subsequently the governments of the European Union decided to move that forward. The government of the Democratic Republic of Congo announced yesterday that the country will finally launch the national COVID-19 vaccine campaign on April 19, and which was initially suspended due to, again, issues related to the side effects of the AstraZeneca. This past Monday and Tuesday, some of you, or most of you, were all on the platform where Chairperson Moussa Faki Mohamed, the chairperson of the African Union Commission, convened a high-level meeting that was also chaired by His Excellency Felix Tshisekedi, who is the rotating chair of the African Union, to really preside over a high-level conference on Africa's vaccine manufacturing for health security. I'm really pleased with how the meeting went. There were over 90 speakers, including head of state from Rwanda. President Kagame spoke and personally called on the full embracement of messenger RNA technology. President Ramaphosa spoke. President Macky Sall delivered a message through the Minister of Health of that country, and Chairperson Moussa Faki also chaired that meeting. As I said, 90 speakers spoke from all over the world. From 70 countries, we were able to record a cumulative attendance of 40,000 participants. So again, that ensures that it highlights that this topic was long overdue. We needed to actually elevate it. And there were 2 major outcomes from this meeting. One was the launch of the African Vaccine Manufacturing Partnership, we call Partnership for Africa's Vaccine Manufacturing, PAM, by President Tshisekedi. and which will really build the right partnerships around technology transfer, knowledge transfer, manufacturing, that is infrastructure and regulatory. In the coming days, a lot of that will be put up, including a task force that will drive that process forward. The second thing that happened was really that a framework and a roadmap on how to roll out this vaccine manufacturing on the continent will be released in the coming weeks. And just again, in the spirit of that partnership, it was very clear that this topic was receiving the appropriate attention. The Africa CDC and the Coalition for Epidemic Innovation, in abbreviation CEPI, signed an MOU to bolster the partnership. That was really a strong commitment of how to move PAM forward. That is the partnership for Africa's vaccine manufacturing. We also saw that the Afro-Exim Bank and African Finance Corporation also signed a partnership to advance vaccine manufacturing on the continent of Africa. So I think that is all very, very good news in the right direction. So in the coming days, we'll continue to provide you with information on how that partnership will evolve and if we are making very specific progress. We really hope that the momentum that we have would make us and enable us to use a stepwise approach to engaging the 5 regions in a way that we set up the appropriate vaccine manufacturing side. Our target is simple, that in the next 20 years, we should be able to move away from importing 99% of our vaccines to importing only about 40% of our vaccines, which means we should be able to, through this partnership, to manufacture ourselves about 60% of our vaccines over a 20 years period of time. It is an ambitious program, but we have to be ambitious to ensure our vaccine and health security of the continent. Let me just then discuss 2 things, then I'll conclude. One is that as of the 12th of April, a total of 34.6 million vaccine doses have been acquired by member states, with approximately 13.9 million doses having been administered. Morocco and some of the breakdown include Morocco 8.6 million doses, Nigeria close to 1 million, Ghana 680 doses have been administered on the continent so far. So really strong uptake for Morocco's 8.6 million, Nigeria close to 1 million, Ghana 680 million. So again, this suggests that if we have the vaccines, the rollout can actually occur pretty quickly. So as of today, 32 member states have received their consignment of COVID-19 vaccines from the COVAX facility, with 12 additional countries receiving allocations through AVAC. Thank you, and over to you. Again, my sincere apologies for starting 10 minutes late today.
Thank you very much, John. We move straight into our questions, and the first one is coming from Samuel Buri, and Samuel is with the Swiss Public Radio. Now, he wants to know the number of vaccine doses that have been allocated by the African Union and to how many African countries so far. I know you touched on that right at the end of your briefing, but let me join that with a question from John McDermott. And John says, given what Dr. Nkengasong said at the start of his presentation, could Africa CDC reconfirm how many vaccines have been bought via the African Union? Which ones are they? Have contracts been signed? And when are these vaccines supposed to arrive? So those are 2 very similar questions coming from Samuel Buri and from John McDermott.
So very good questions. I think the first is respect to the only vaccines that AVAC has distributed are those vaccines that came from the MTN donations to a few countries, and these were all the AstraZeneca vaccines which we bought from South Africa. And since we really don't have a continuity acquiring the AstraZeneca vaccines because of the situation in India. I mean, that is all for now that we have distributed to our member states. That is the 12 countries that received the AVAC vaccines. So with respect to John, your question about how many vaccines, let me just be very, very clear. We have signed a contract with Johnson & Johnson for 220 million doses of vaccines, with an option of getting an additional 180 million doses of vaccines if need be, going forward. Now, in terms of delivery, we are projected that the delivery will start the third quarter, okay, and July or so. If we have early deliveries, fine, we'll make that available to countries. That is what, so if you consider that the 220 doses plus the 180 million doses, that all of that will be uptake, then you are referring to about 400 million doses. That is where we are. Previously, we were in discussion because in this vaccine negotiation, which I'm learning a lot with the experts that deals with negotiation, you agree and you sign a contract. In January, we had agreed with the Serum Institute that we acquired the 270 million doses of it. As I said, and that led to the announcement with President Ramaphosa. The vaccine terrain is extremely complex. I mean, and you negotiate today, tomorrow the company is not in a position to deliver, and you can't sign until you sign a contract. You have no vaccines. So what we have actually signed now is with the Johnson & Johnson. So I think that is what I explained earlier today. So I'll leave it at that. So 220 million doses of vaccines from Johnson & Johnson, with an option of acquiring an additional 180 million. And the delivery time point is beginning third quarter of this year.
All right. Thank you very much. Let's say good morning to Paul Adepoju. And Paul is with the Lancet, and he has questions on vaccines as well as Ebola. Good morning, Paul.
Hello, good morning, and thank you, Dr. John. And let me say congratulations on the vaccine conference. It was quite thorough. So my first question has to do with the Ebola outbreak. And the first question is regarding the recent finding that a new outbreak originated from someone infected back in 2014-2016 pandemic. What are the implications for stigmatization and people coming forward, especially medical workers working? So what are the implications of that? And especially with COVID-19 putting public health in general life. So what is being done to address this? The second question is, what is the latest timeline regarding COVID-19 vaccine availability in Africa? You were initially concerned about vaccine hesitancy, but in several African countries, they're already exhausting the doses that they have. So has there been strong evidence to support the impact of vaccine assistance in Africa, or were the initial worries no longer a major concern? Thank you very much.
No, thank you, Paul, and thank you for taking the time to attend the vaccine conference, which I really hope will be a turning point in our ability for our continent to ensure its health security through vaccine security, diagnostic security, and therapeutic security. And that is what we are calling a new public health order, which was also discussed abundantly by President Tshisekedi and other panelists. I think we have really embracing a new public health order, which is really underpinned by ability to think boldly, to think bigger, and to think to build back better the continent. I mean, that is, we will be driving that agenda very, very aggressively for our continent going forward. Now, with respect to the two other things you raised, that is stigmatization, the findings in Guinea, where this outbreak seemed to have occurred, is extremely concerning. And it also makes the situation very worrying, which means once an Ebola outbreak is declared over, we need to monitor people that were infected for over a very long period of time and do even in-depth analysis of where the virus might be hiding. We know that there are certain components of the body, like semen, where the virus seems to be hiding and can persist for long. Viral persistence is not a new phenomenon. I mean, in HIV, I work in HIV research for 29 years, and one of the greatest challenge you have with HIV is that it hides in those compartments of the body that you can't find it, and where drugs cannot get access to. So I think it's a new development, but it also points to the fact that you should never claim that you know these microorganisms well, because there will be always be surprises there for all of us. So that the stigmatization comes with our ability to understand what we are dealing with. I believe that it only suggests to us that in public health, we need to prioritize behavioral scientists to engage in the fight against unknown diseases, so that they can truly understand what the community is thinking, what their concerns are, and their fears are. The first reaction of a human being is fear when you are dealing with the unknown. And when you are dealing with an unknown disease like Ebola or COVID-19, I think it always starts with stigmatization. And you don't want to go next to somebody who has been a victim, and even with all this. So it only tells us that we need to do a better job as public health experts to communicate with the community, engage the community so that they lead the response, own the response, and actually be part of the entire response. So it is work in progress that we hope to look at what is unfolding in West Africa with additional research and support that as much as possible. With respect to vaccine hesitancy, I'm extremely encouraged by what we are seeing with respect to vaccine uptake in Morocco, with respect to vaccine uptake in Mauritius, Seychelles, Rwanda, and Ghana. They've exhausted the initial doses of vaccines that came in there. So again, any study that we did a few months ago is a snapshot of the situation. So what you want to do subsequently is to do another study to see if behaviors are changing. And my submission or thesis is that with time, when people see the benefit of these vaccines, more people would like to get the vaccines. I think that is, that is a hypothesis that I'm putting up there, and I think that early indicators would suggest that. But it doesn't mean that all components of the community will be taking those vaccines. It also suggests that we have a lot of work to do to really understand the community, who is taking the vaccine, who is hesitant to take the vaccine, and where should we focus our efforts to actually do more work to get the community engaged and improve our risk communication components.
We have questions. One question coming from Claire Keaton, and Claire says, I'm with the Sunday Times in South Africa. And she says, what is the Africa CDC's response to the pause on the J&J COVID-19 vaccine rollout?
And we're coming out of that briefing to take you